Hi everyone, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about telehealth. Telehealth or telemedicine is something that has grown rapidly over the last 5 years in popularity in healthcare. I have not done like a very basic video about telehealth, so that's what today's video is going to be on. What is telehealth? Why is it used? Who should use it? Can you bill for it? How it's billed, etc. Telehealth is a virtual platform that will allow providers to treat and see their patients through an electronic means using a camera and audio capabilities for certain appropriate reasons. And when I say appropriate, I feel that there are some situations where telehealth may not be appropriate, in my opinion. I don't feel like it's good medicine. But then there are other situations where I feel it's perfect opportunity to help be efficient, have patients be happy with the service they're receiving, and also allow providers to see more patients in a more effective and safe way. Okay. Basically, a telehealth platform is available through an EMR company. There's some companies that just offer telehealth platforms. That's all they do, and they might interface with an EMR or you use it independently. They do have to be HIPAA certified. There is certain criteria that does need to be met. I believe Zoom actually has a HIPAA certification for using. They used to, at least they did during the pandemic. I don't know if they do now. I'm more familiar with the EMR systems that have their telehealth platforms built in. So everything's in one: your scheduling, your patient portals, your billing, and then your telehealth. It's all in one place. To me, I feel like that is just easier to track. It's easier to manage. It's easier to remember, etc. But basically, it's going to be a platform that patients would be calling in or accessing from wherever they are, whether they're at home, they're in the car, they're at work, whatever is convenient for them, where they're at during the time of their appointment. It's still a scheduled appointment with the provider. The provider will get on, talk to them face to face, just like this, virtually through a camera and the audio microphone, and be able to have a conversation with them about their chief complaint, just like they would if they were in the office, which is really, really nice. This is great for patients maybe to be more compliant with their health care, for them to maybe be more prone to going to the doctor more proactively if they're not feeling well or having an issue with a medication or something like that, because it's a little bit more convenient. A lot of doctors' offices will have a staff member get on the call first and maybe just kind of get more information from the patient while they're waiting for the provider to join the call. They might have them come on and collect the copay if there is one, because a lot of times insurances still will require a copay for this visit. A lot of times the platforms will allow the copay to be paid from the patient side when they're checking in or logging into their telehealth platform for their visit. It will notify them that they have a copay and ask them to pay it. There's many, many different ways that this can work. However, it's all done electronically, virtually, however you want to look at it. There are some insurances that will cover audio only visits. It's not as common as it was during the pandemic when they were a lot more flexible on this. Really, it's coming down to the virtual needing to be able to see the patient and talk to the patient live. That is going to be what telehealth is. There are certain specialties where telehealth has permanent approval through Medicare, like behavioral health, for counseling. I know dietitians a lot of times can use telehealth, social workers, counselor, therapists, where there's final rules covering telehealth. And that's fantastic, right? Because most of those visits are just looking at patients and having conversations with them. Why can't we use this technology to help patients, make it more convenient, make it more readily available to them across state lines, right? You might have a behavioral health person who is in Oregon, but they offer it in multiple different states, which is great because this is definitely a place in healthcare that we have seen a deficit of needing more mental health practitioners, and this should be able to help that. That was one of the intended benefits of them giving the final rule. Now, when it comes to telehealth for other specialties, they are going to be going back to more strict guidelines. And actually, the current Medicare guidelines that were put into place during the pandemic are going to be changing at the end of March. So, beginning April 1st, telehealth guidelines, what will be able to be billed out, what kind of visits will be accepted, how they will be reimbursed, things like that are going to be changing. I'm not sure if Medicare has announced those official changes yet. They had just said that first they were going to change it at the beginning of 2025, and then they said, no, we'll push it out until after the first quarter of 2025. So April 1st is when the final changes will come. If you do a lot of telehealth or you're thinking about wanting to offer telehealth, you need to be looking at the CMS website about telehealth changes. Most insurances will follow Medicare guidelines. That is something across the board, not just with telehealth, but with healthcare billing, healthcare coverage in general. They follow Medicare guidelines. Right now, you can bill with Place of Service 2, Place of Service 10. If you're not familiar with Place of Service, I have a video on that, but you can also Google it and look up all the different Place of Service. Place of Service 11 is your typical office visit. Place of Service 2 is going to be one part for telehealth. Place of Service 10 is going to be another. Some insurances require or only accept certain places of service for telehealth. Some of them require a place of service and a modifier on the CPT codes in order to cover telehealth. You have to check each individual payer's telehealth guidelines on what they cover, how they cover it, meaning is it paid at 100% of what they would pay if you saw the patient in person, which a lot of them have gone away from that. They pay a percentage of that, which makes sense, right? You're using less resources because they're not coming into your office. So they're reimbursing telehealth services a little less, but their guidelines would tell you that. They would tell you which places of service they accept or don't accept. They would tell you what types of visits they accept and don't accept. And they would tell you how to bill it correctly, not just with the place of service, but if any modifiers are required as well. It's really, really important not just to monitor the Medicare changes and announcements for telehealth services, but you have to look at every individual insurance in which you bill because they're all going to have different billing guidelines, policies on coverage, and you don't want to be losing money by not following these. Again, most insurances will cover some sort of telehealth services. They have to be with a camera, with audio. They are for certain types of visits, certain specialties. You have to bill them with certain places of service, certain CPT codes, certain modifiers, but they will cover it. Again, Medicare is going to be coming out with more strict guidelines that most insurances will probably follow. So you need to stay up on that because they would go into effect April 1st of 2025, not very far away from here right now. Telehealth is one of those things that can be very, very good and very appropriate. However, make sure if you are adopting that in your practice that you're using it for the best of you and the patient, not just to try to fit in more patients during the day to be able to bill more services, not just to always be convenient for the patient or yourself. It needs to keep patient safety in mind. Are you practicing good medicine? You can't put your hands on patients in telemedicine. You can't observe them fully. You're just going to see what you see on the screen. And sometimes in medicine, especially putting your hands on people can tell you a lot. And you don't want to miss something because you're trying to be accommodating to a patient or you're trying to see more patients to get in more revenue. You still have to keep in mind that you do no harm and you're going to be using it appropriately. If you have any questions or comments about telehealth, what it is, things like that, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit. I very much appreciate the support. We'll see you next time. Bye-bye.